Hi everyone, I am Shahan. Welcome back to my channel, and in this video I will tell you about phimosis. Phimosis is very important topic for your NEET PG or FMGE examination. So if you are preparing for NEET PG or if you are preparing for FMGE examination, you must understand this topic because every year they ask question on phimosis. Now, what is phimosis? In this video, I will show you what is the treatment, everything. You can see the left-sided picture. The glans, that is the head of the penis, and over the glans, over the head of the penis, there is a loose skin, and that is the prepuce. And prepuce can be very loose, that is normal prepuce, but when it is tight, you can see on the right side picture now, the prepuce has become tight and the prepuce cannot be retract. So tight unretractable foreskin, tight unretractable foreskin, this cause a disease, and the name of the disease is phimosis. The name of the disease is phimosis. And because of this unretractable foreskin, the foreskin cannot be pulled back and it become tight and it become fixed, so it cannot be moved, and because of that several other problems also occurs. So let us discuss what are the symptoms of this condition known as phimosis. Number one, narrowing of the foreskin cause infection. Whenever the foreskin is very narrowed and whenever it become unretractable, that the person cannot retract, then it becomes infectious. So there is infection growth in this portion, basically in the glans portion of the penis, and it becomes red, it becomes swollen, it becomes infectious. So because of the narrowing of foreskin, you get infection and you get inflammation of the glans penis. That is very important. Inflammation of glans penis, and because of infection, because of inflammation of the gland penis, you get pain. So very important feature is pain. Another important thing which I will discuss is this one. This is a similar condition like that of the phimosis, but this is not actually phimosis. It is known as paraphimosis. It is known as paraphimosis. Now, what is paraphimosis? You can see here that the edematous foreskin, when the foreskin has edema in it, when the foreskin collects a lot of fluid in it, then it becomes edematous. Then we can say it is paraphimosis. Basically, it has a particular ring. You can see around the neck of the glans penis, you get a ring, and that is very important. Note the bluish discoloration as the result of the constriction caused by phimosis ring. Because of the phimosis ring, there is a bluish discoloration, there is collection of fluid, there is edematous foreskin, there is a ring, that is known as paraphimosis. So paraphimosis is slightly different from phimosis. You must know the difference, because sometimes they ask what is phimosis, what is paraphimosis. They may ask you with a case and you have to distinguish which one is paraphimosis and which one is phimosis. Whenever they give you, remember, whenever they give you something with edema around its neck, that is paraphimosis. You can see this picture, left side is the phimosis and the right side picture is the paraphimosis. In left side you can get the skin which becomes unretractable. You cannot retract your skin. That is very important. But in case of paraphimosis, on the right side you can see that you get a ring, you get edema in the prepuce. That is very important. So there is a distinguish between the phimosis and paraphimosis. You must understand, in phimosis the foreskin become tight, it cannot be retract back, it is not loose now, it is so much tight that you cannot pull it back. Even during the sexual process, you cannot put it back. So it is in phimosis. But in case of paraphimosis, you get edema, you get a ring, and this ring is very famous. Sometimes they give you only the picture of the penis with the ring, and you have to understand this is actually the ring around the penis. So it is not phimosis, it is another condition which is known as paraphimosis. Whenever the word is para, then you have to remember there will be ring around it. So what is actually the treatment of this phimosis? Basically we are talking about phimosis, so let me discuss about the treatment of phimosis. You can see the left side is the uncircumscribed penis, on the right side it is circumcised penis. Now these two are different. Let me tell you the difference first, then you will understand what is uncircumscribed penis and what is circumscribed penis. Then I will come in the treatment of the phimosis. You can see on the left side it is uncircumscribed. That means the foreskin is above, the glands, that is uncircumscribed. But when it is circumscribed, you can see on the right side the foreskin is cut with the help of a surgery you do, and the foreskin is cut and there are little stitches that is done at the portion ridge mentioned here, that is the neck of the glans penis, and you get a circumscribed penis. And why do people do it? Maybe sometimes due to religious reasons, sometimes due to phimosis. This is very, very important because phimosis has the problem that you cannot retract your foreskin back, so it becomes very tough, it is very painful, it is inflammatory condition, and so there is a red swollen glans penis you get, and that is why there is one surgery option. But surgery option comes later. First is you will do with the help of the medicine, but later we will do the process of circumcision. You can see in the picture how the process is done. There are basically two kinds of incision. You can see one is horizontal incision, another is the vertical incision. Whenever first the horizontal incision is done, then a vertical incision is done in the prepuce so that you can separate the two flap of the prepuce and divide into two half, and later that is the prepuce is cut from the glans penis and the glans comes out, and then a small stitches on the right side picture you can see small stitches are done at the neck of the glans penis and the process is completed. This is basically the surgical management, but generally first it is not done. First we do the medical management, and if it is not done then we go for surgery. So let us rewind what we have learned from this video. The first one is phimosis, which the topic is. Phimosis is inability to retract the foreskin. Inability, you cannot retract. You can see the left side picture, and what it causes, it causes pain. It causes pain in the glans penis basically, and inflammation and also redness, and sometimes it can also cause infection. So we need to manage medically first. Antibiotics and other things are given. Then we can also give the topical steroid cream. The main treatment is topical steroid cream. Another is periodic gentle retraction. Periodic gentle retraction of the prepuce. We try to gently retract it and manage it. But if it doesn't occur, then we will go for circumcision. On the right side picture, you can see paraphimosis. This is another topic which I discuss alongside with phimosis because sometimes you may confuse with phimosis. In paraphimosis, you can see the inability to reduce the foreskin back to the anatomical position. It is more or less the same condition, but there is a problem. The problem is bluish discoloration. Always the paraphimosis will have the bluish discoloration. Along with that, you always remember there is a ring in case of paraphimosis that is known as phimosis ring. You can see this ring is around the glands, basically on the neck of the gland where the glands ends and it joins the shaft, you get this ring, and this ring is very, very important because this distinguishes us from phimosis. So paraphimosis is different from phimosis. In phimosis you get inability to retract the foreskin. In paraphimosis also you get that, but what makes the difference? The difference is there in the ring. Always remember the difference is there in the ring. Always remember, in paraphimosis you get the ring, but in phimosis you do not get the ring. So this is the end of this video. If you like this video, make a thumbs up and please subscribe this channel if you are new to my channel, because every day I upload new videos on different diseases. You will learn a lot about different diseases. If you are preparing for NEET PG, if you are preparing for FMG examination, please subscribe this channel, because this channel contains all the topics that are asked in the NEET PG and especially the FMG examination. And if you are preparing for PLAB or USMLE examination, we have a special series for that. You can visit the playlist of our channel, and there is a playlist known as USMLE PLAB. You just run the playlist and watch all the videos from that. And there is another very beautiful playlist all about diseases. You can learn all the diseases from that playlist. You can search disease playlist and you will get a lot of that. The name of the playlist is Must Know Diseases. You can watch all the videos from there and you will have a lot of idea about medicine, pathology, all these things. We have separate playlist on pathology also, on medicine also. You can watch all the videos and you will get great knowledge from this video. Thank you so much. If you like this channel, please subscribe this channel. Have a nice day. Bye bye.